Hello everyone, I am Dr. Himika Chawla. I am Senior Consultant Endocrinology at PSRI Hospital. Today we are going to be talking about the much talked about drugs which are GLP-1 receptor analogs. Now we need to understand what these drugs are and why promotion by celebrities and influencers is not the best thing to do when it is about prescribing medications. So now these medications, that is the GLP-1 receptor analogs, they are basically anti-diabetic drugs. They were designed and developed over several years of research as medications for diabetes, for blood glucose lowering action of theirs. And during the trials, when these drugs were developed, it was seen that they have a powerful weight reduction also. Now, a lot of patients with diabetes are also struggling with obesity. Obesity, in fact, is a major cause of causing type 2 diabetes worldwide and in India as well. So obviously the weight reduction that came with the blood glucose lowering effect of these medications was a welcome thing. So much so that the trial saw that the weight loss was going to the tune of more than 10%, even to the tune of 15 to 20% in many patients in whom these drug was tested. So which is why this drug, and especially the higher doses of the drugs, then got developed into anti-obesity drugs as well. And since their blood glucose lowering action is related to the blood glucose that the patient has, so it will not cause low blood glucose, it will just bring down the blood glucose to the normal range. It was developed as an anti-obesity drug also. But we need to understand that this is a prescription medication. It's not an over-the-counter drug, and it does come with its own set of side effects. Now these side effects are basically related to the effects of this drug. This drug causes a lowering of your appetite. This drug causes a slowing of your gastric movement or the movement of your stomach. So how slow your stomach empties, which is why you feel full for a longer period of time, you feel satiated for a longer period of time. And this, in addition to the alteration in the appetite that happens, and especially the fact that it addresses your cravings also. So you end up eating lesser and you end up feeling fuller. So that is why the weight loss is there. But for the same reason, since you're having a slowing of the gastric emptying, since you're having a reduction in your appetite, some patients can experience extreme reduction in hunger, so they can eat very less, which can actually compromise on their nutritional status. Very importantly, because of the gastric emptying that is slowed down, the patient feels constipated. They can also feel nauseous. They can even end up having vomiting. Also to remember, if the drug is not taken as per prescription, and the way to give it is that as doctors, we see the patient's condition, give it in a staged manner. So you start with a lower dose and then you keep on increasing the dose slowly and steadily as your patient is tolerating. So we do assess the gastric tolerability of the drug with the patient, and we only increase the dose if the patient is comfortable with a particular dose, and we as doctors are comfortable with the kind of weight loss that is happening and with the kind of blood glucose lowering that has happened. So should the up titration be very quick, which can happen in the hands of unexperienced patients who don't really have the entire background of the drug, that can lead to these side effects being exaggerated. And sometimes there are rare case reports that patients can even end up having pancreatitis because of incorrect dosing, because of using very high doses of the drug. Plus, in addition to that, if there is a very rapid weight loss, so there is a pace of weight loss also that we can do with our patients. So if you have a weight loss which is going to the tune of more than 5 kgs in a month, some patients can also end up developing gallstones. So that is again a difficult complication to manage, because the patient may end up requiring a surgery to remove the gallbladder. So these side effects have to be taken into consideration, and whenever we prescribe them as doctors, we do have a checklist which we use to identify, first of all, which patient would benefit from this drug. So is the patient actually obese, or is he just taking for a cosmetic concern? So if there's a significant obesity which is leading to metabolic abnormalities like diabetes, hypertension, fatty liver disease, or heart disease, or obstructive sleep apnea, or knee osteoarthritis, wherever we feel that the blood glucose lowering action or the weight reducing action of the drug will be helpful for the patient, we go ahead and give this drug in a structured manner, in kind of dosing that we would feel comfortable and safe for our patients. We do the counseling of our patients as well in terms of the side effects that they can expect, how to go about managing these side effects, because these side effects can be actually reduced by using a blandish diet which is low on spices, which is low on fat, not eating when they are not actually hungry, eating to maybe 80% of their appetite, avoiding fizzy drinks, avoiding alcohol. So these are the strategies that we use as mitigation strategies to reduce the side effects which are associated with these drugs. And these are important whenever we prescribe these drugs, so that it's a safe experience for our patients, and our patients don't end up developing gallstones, or don't end up with some acute pancreatitis, or don't end up with severe diarrhea or severe constipation or severe vomiting, which can actually cause dehydration and sometimes acute kidney injury as well. So these are prescription drugs. Yes, they are good drugs. They are very beneficial for people with obesity, with people for diabetes. But yes, they are not for everyone. The patient has to be carefully selected by the doctor, and only when it is safe to be given to that particular patient will the doctor prescribe these drugs. So, a rampant sort of marketing of these drugs and involving influencers and celebrities, is only going to just make people, abuse it. Maybe for many times cosmetic concerns, also not taking in the right manner and ending up with significant side effects. So I think anybody who is going to be an eligible candidate for a GLP-1 receptor analog should be carefully screened, selected, and advised both on how to go about the medication and how to take care of the side effects by a doctor who's trained to do so. Thank you.